Good afternoon, this is Dr. Walker. Welcome back to the channel, denwalker.com. We'll talk a little about vitamin D and vitamin K2 this week. Some questions about how much vitamin D, how much vitamin K2 to take, and the importance of both of those. As you well know, that vitamin D helps to sort of transport calcium essentially from the gut and elsewhere in the body and put in a serum concentration. And then the intent is that the K2 is going to then mobilize those calcium, if you would, and put it into spots where it needs to go, i.e. in your bone and bone matrix and so forth. So just to keep your bone normal. Now, if you have just an isolated elevated vitamin D levels, and you're taking additional vitamin D supplement, then yes, one could run the risk of getting hypercalcemia, but that's the whole gist of the vitamin K2. That's the job of the K2, to essentially get it mobilized from the serum level into your bone. So if you're taking 10,000 units of vitamin D by itself, and again, vitamin D is going to absorb the calcium from the GI system into your blood, you can run the risk of hypercalcemia, as too much calcium in the blood. But again, for the most part, it's a theoretical risk. Most of us, and some people say about 80% of us in the U.S. are vitamin D deficient to some degree. So my suggestion would be that you start somewhere around 4,000 or 5,000 units of vitamin D. Then in 6 to 8 weeks or so, get your levels checked to see exactly where they are. And those levels, I suggested in the past, they should be somewhere between 80 and 100 nanograms per milliliter, thereabouts. And if you're taking about 5,000 units of vitamin D, I take about 10,000 myself, then you need about 100 micrograms of K2 to go along with that, right? So about 5,000 units of vitamin D, you need about 100 micrograms of K2. And again, K2 helps to mobilize, in fact, it will take it out of the soft tissues and wherever else, and get it deposited into your bone. So people that run the risk, or people that have known osteoporosis or osteopenia, if you have osteopenia, one great way to help that would be, again, increasing vitamin D levels and increasing your K2 levels. Again, your levels should be between 80 and 100 is what I suggest for it to be, and then just to decrease your risk of osteoporosis. Now, a lot of folks will be given things like Fosamax and Actonel and so forth for either osteopenia or osteoporosis, which I'm not a fan, just not a fan of that, because there are other complication, for example, with Fosamax, for example, esophageal cancer, that you increase the risk for with that. And it really doesn't, in my opinion, it really doesn't help you that much in terms of getting your bone density. On the test, on the DEXA scan, your test may become more normalized, but when it comes to the actual bone itself, because bone is actually, it's not just made by calcium, obviously, right? It's made by other things, not just calcium. So just taking Fosamax by itself, getting your bone density to be normalized, it's a sort of a fake out, essentially. And sometimes Fosamax and those things will actually make your calcium level decrease, which is kind of a weird thing, but that's true. And Fosamax, as I said before, Fosamax increases, in some people, there's an increased risk of sort of low-level trauma causing bone fracture, specifically in your femur, the strongest bone of the body, and the strongest part of the strongest bone of the body. You get these osteoporotic fractures and so forth. So I would say if you're at risk for osteopenia, osteoporosis, then definitely increase your vitamin D levels, increase your K2 levels, and again, those things will help mobilize the calcium to your bones. And based on those numbers I said before, increase your calcium levels into your bone matrix, if you would. So then your risk of osteoporosis is decreased. Also, you can try to add, if you're looking at needing additional supplementation, just kind of think about the natural foods that you can use to increase your calcium levels, increase your bone calcium levels. Things like goat milk, for example, broccoli, green leafy vegetables, and so forth. Bok choy can also help with increase your calcium levels. And those are the natural ways. And some people, there's some conversation about whether or not, if you just take calcium supplements by itself, how well does that really work? And as far as I know, it doesn't work that well, right? So I would do the things that have been known to help you with osteoporosis and osteopenia by increasing your vitamin D, your K2 levels, and maybe increase some of the more natural foods. I mentioned some before. Goat's milk is a great way of doing that. Broccoli is another good way. Bok choy is another good way. As opposed to taking another supplement. And again, I'm not a big supplement person from a standpoint of medication supplement. I'm talking about. I'm not a big fan of that because you're being sold a pill, and the pill is supposed to do, in this case, Fosamax, for example, is supposed to do one thing, was supposed to increase your bone density, but then what does that mean, right? What does that mean? What else does it do, right? That's the other issue. If it were just to increase your bone density and the bone that you have as a normalized bone, then great, right? But it's not. It's not, as far as I understand. So I would stick with more natural things. More natural supplements, again, vitamin D and vitamin K2 to help you with those. Vitamin D and K2 are both fat-soluble vitamins, which means you need a little bit of fat to go along with that. So things like pistachio, macadamia, avocados, for example, olive oil are a great way to sort of help increasing your the vitamin D and vitamin K2 levels for you. And again, if people, the only real concern I would have, or have people kind of know about, is if they're on warfarin, for example. Warfarin is sort of a blood thinner. There can be some difficulty managing your Coumadin levels, your warfarin levels, if you're on K2. So if you're on Coumadin warfarin, then let your doctor know, because they may need to understand that you do additional supplement, which may change the how well your those drugs work for you if you're on them. So that's the only big caution. Vitamin D, again, there is some conversation about causing hypercalcemia, but I've actually never seen a case where the person had essentially normal calcium levels, take vitamin D, and then their serum levels is so high that they're diagnostically hypercalcemia. Hypercalcemia can predispose you to kidney stones and those kind of things, but I've never seen a case of it, and it's a theoretical risk from what I understand. And so if someone has a documented case of that, feel free to send it to me. But I've never seen a true to life case of someone taking vitamin D supplements and end up with, quote, hypercalcemia, causing complications from hypercalcemia. So if you have that, let me know. Otherwise, that is my discussion today. I'll put the links in the bottom of this video to talk about that shows some other documentation in terms of how much vitamin D to take, and kind of go from there. But again, get your levels checked in 6 to 8 weeks or so after you start your vitamin D supplementation, just to kind of see where they are, right? And then once you have a number that's steady for you, then just keep on that number. And for me, it's right now, it's 10,000 units, and that's what I'm doing. My spouse is on 5,000 units, and her levels are just at the bottom end of the range I just mentioned a second ago, 80 to 100 thereabouts. Anyway, thanks for listening, Dr. Walker. Have a great day.